What is HIV and AIDS?
HIV stands for human immunodeficiency virus. It can turn into AIDS, which stands for acquired immunodeficiency syndrome. HIV spreads through blood via shared needles, through childbirth, and through unprotected sex.
What are the different types of HIV and AIDS? HIV type 1 is the more common type. It accounts for 95% of HIV cases and spreads more easily than type 2, which only accounts for 5% of cases, most of which are currently in Western Africa. HIV type 2 is also less fatal and progresses more slowly than type 1.
HIV originated from a disease called SIV, a kind of transmissible disease. SIV-CPZ, or simian immunodeficiency virus, was the variant that spread from chimpanzees to humans in the southeastern part of Africa. Humans came in contact with the virus when chimpanzee blood was exposed during hunting. The virus entered the human population around the early 20th century.
HIV spread throughout Africa due to sex work, migration, trade, and trucking. It spread between urban areas. The first epidemic was in Kinshasa, a city in Democratic Republic of Congo. From there, HIV spread to East Africa. Uganda was hit particularly hard in the 1980s, where AIDS was particularly called the Slim disease. Connections between the Slim disease and AIDS in the US were recognized. HIV then spread to West Africa.
Government's responses focused on preventative measures, which involved encouraging abstinence, monogamy, and condom use. The emphasis on condoms created tensions with Christian and Muslim religious organizations, which saw this as promoting sex. That made it harder for governments to educate people about prevention.
Different African governments responded differently to HIV/AIDS. Senegal had a strong response with quick government involvement and effective community organization. Uganda worked with the World Health Organization to create a plan that focused on education and destigmatization of HIV to deal with the epidemic. These countries' responses contrasted with that of Congo, which banned discussion of HIV in the press, and Zimbabwe, which banned doctors from mentioning HIV/AIDS on death certificates.
Once HIV treatments were developed in the US, most areas of Africa were not able to widely access these treatments because they were incredibly expensive. HIV treatment costed between $10,000 to $15,000 per person each year. Pharmaceutical companies refused to lower the prices, and the US government protected these companies despite the crisis in Africa. Eventually, under Clinton, patent laws on HIV drugs were lessened so that countries could produce their medications themselves instead of having to buy them from American companies
HIV was first discovered in the U.S. in 1981, but it was likely there since the late 70s. The AIDS epidemic in the U.S. began in New York before traveling to San Francisco. Today, 4 decades later, 79.3 million people have been infected with HIV and 36.3 million people have died. Developing countries are more affected by HIV and AIDS because of lack of access to preventative measures, treatments, and resources.
Symptomatic stages of HIV/AIDS. The first stage of HIV is acute infection. During this stage, there's a high amount of HIV in the infected person's blood, and the disease is highly contagious. Symptoms are generally flu-like, including fever, chills, rash, night sweats, muscle aches, sore throat, fatigue, swollen lymph nodes, and mouth ulcers.
Chronic HIV infection is the second stage of HIV. Chronic HIV is asymptomatic in many people. In this stage, HIV is active but reproduces very slowly. There is a medicine available to prevent patients from moving on to stage 3.
AIDS is the third and final stage of HIV and AIDS. AIDS badly damages the immune system, which makes victims very susceptible to other infectious diseases called opportunistic infections. People are diagnosed with AIDS when the CD4 cell count, or the white blood cells that fight off infections, is below 200 cells per millimeter. People can have a very high viral load during this stage, and most die within 3 years if they do not have the treatment available to them.
What were the social impacts of HIV/AIDS? AIDS first emerged in the US in the 1980s among queer men and was originally called GRID, or gay-related autoimmune disease. People later figured out that it wasn't only gay people who got HIV/AIDS, but that anyone could be infected. It was first observed in gay people, immigrants, and drug users, all marginalized populations.
Due to the most affected groups being marginalized, the governments did little research on HIV. People did not know how it spread, and some would not even touch a person who had AIDS. AIDS patients were neglected by hospitals and medical staffs who did not want to get near them. The association with gay people with the deadly diseases contributed to increased homophobia as well. Ronald Reagan, who was the U.S. president during the height of AIDS epidemic during the 80s, was silent on the issue. He cut funding for the CDC and did not support funding for the research, even though thousands of people were dying.
HIV and AIDS disproportionately impacts Black and Latino people in the U.S. due to unequal access to prevention and treatment from racism and systemic inequality. Treatments were more readily available to white people than to minority races.
People advocate for HIV/AIDS victims. Activists protested the U.S. government's lack of response to the virus by creating the AIDS Walk as part of the AIDS Project Los Angeles in 1985. Hundreds also protested in New York at a March on Wall Street in 1987, and many were arrested.
The March on Wall Street was organized by an organization, ACT UP, which stands for AIDS Coalition to Unleash Power. Through demonstrations and protests, the group was eventually able to force the U.S. government to pay attention to HIV/AIDS and ultimately change the way they conducted medical research.
The LGBTQ community created help groups to bring those who are sick to doctor appointments and help care for them. The Gay Men's Health Crisis, GMHC, was the first organization set up to support HIV-positive people.
People protested at the FDA headquarters by lying down in front of the building and holding up signs shaped like headstones with messages about how the FDA's refusal to release drugs to treat HIV/AIDS was responsible for their deaths. These protests, called die-ins, led to the FDA beginning to make treatments.
What are the solutions to HIV and AIDS pandemic? The first anti-HIV drug was AZT, which was somewhat effective in preventing HIV to pass to babies during childbirth and slowing the progress of HIV. This was followed by the combination therapy of AZT and another drug, DDC. After that was the creation of HAART, which was a triple drug therapy. It could drop HIV levels to undetectable but had a lot of side effects and required specific difficult medicine-taking regimens. The current treatment for HIV is an antiretroviral therapy called ART. While HIV does not have a cure, taking ART can reduce the amount of HIV in the body to the point where it's no longer transmissible. Other treatments like PrEP are preventative treatments that those at risk contracting HIV can take. The risk of getting HIV through sex is reduced up to 99% by taking PrEP.
How are HIV and AIDS still affecting us today? 2.78 million children and adolescents were living with HIV, nearly 88% of them in sub-Saharan Africa. Only 54% of infected children and adolescents were on HIV treatment as compared to 85% of pregnant women living with HIV. At least 300,000 children were newly infected with HIV, or one child every 2 minutes. 120,000 children and adolescents died from AIDS-related causes, or one child every 5 minutes. Thank you. This is Evelyn,
Jolene,
And Clay.